guys, welcome back to Yoga with Leona, your site for everything about yoga and breast cancer recovery. Great to see you again today. So today's video is a tutorial that was requested by two of our different members about what can I do about the tightness in my low abdomen that I have from my DIEP flap reconstruction scar. So as many of you know, there are lots of different options for breast reconstruction, and one of them is called the DIEP flap, and the DIEP flap requires a big incision in the low abdomen where they harvest the tissue that they use to then rebuild the breast. So many patients after a DIEP flap will have this long incision across the low abdomen, and they'll complain of some tightness or some sort of contraction of that area. So if you imagine, it's almost similar in a way to the contraction I talk about in our upper chest. So for most of us who've had some kind of surgery in our upper chest, we often end up with this sort of rolled forward, contracted front side of our body, which winds up causing sort of a lengthening and a weakening of the muscles on the back side of our body. So in the low abdomen, it's similar. So when that skin is really tight because of the way that they have to repair the site that they took the tissue from, when that skin is really tight, you end up with some forward sort of contraction of the front side of the body, and you end up with a lengthening and thereby a weakening of muscles on the back side of the body. So before I start into the few special stretches that I like to open that area up, let's talk just a little bit about what happens in the body when that occurs. So I'm going to turn to the side so I can show you. So when you've got a lot of tightness in the low abdomen, a couple of things can happen. So the upper body can sort of bend forward a little bit to try to sort of appease that tightness in the low abdomen. So you can end up with a slightly forward stooped posture, and you can see how that would be hard on the muscles in the low back, and you could end up with some low back pain relating to it. Now you also can get what's called a posterior pelvic tilt, where instead of the normal neutral position of your pelvis, the pelvis sort of rolls back a little bit. And I hope you can see that. I'll demonstrate it a little bit more. So imagine that your pelvis is a bowl of water, and when the pelvis tilts posteriorly, the front side of the pelvis lifts up and the back side droops down a little, so water would spill out the back of your bowl of your pelvis. Now, some people have a naturally anteriorly tilted pelvis such that the water would spill out the front side of that bowl of your pelvis. In people with an anterior pelvic tilt, they often have an exaggerated or a dramatic curve or arch in their low back. And then some people have a natural posterior pelvic tilt, and I'm actually one of those people who naturally has this even without having had a DIEP flap. So I invite you just to think for a moment and place your hands on your hips and feel your pelvis tilt slightly to the front. So the pubic bone tilts down. Imagine the water spilling out the front of the bowl of your pelvis. And then tilt the pelvis back. So you're tucking the tailbone in and imagining water spilling out the back of your pelvis. So you can imagine how a lot of tightness across the low abdomen might result in a posterior pelvic tilt. So what happens when you have that, if you have that, is you get a shortening or a tightness or contraction of the muscles on the front side of the body. So that could be your abdominal muscles, and that could be also hip flexors and muscles here in the fronts of your thighs. But then you get a lengthening or a weakening of the muscles in the low back. So this can happen to people with a DIEP flap. As I mentioned, some people just have a natural posterior pelvic tilt. It also happens to people who sit in chairs a lot for work. So if you've had a DIEP flap and you're required to sit in chairs a lot for work, you may really be struggling with this. So it's going to make you have some discomfort in your low back, and it's going to make you have a tight feeling in your low abdomen. So as I mentioned, a couple of my members said, hey, could you make us a tutorial with some special stretches that might help us out with that? So that's what I'm going to do today. So even if you haven't had a DIEP flap, if you sit in chairs a lot for your work, or you struggle at all with mobility and flexibility in your low back and pelvis, these stretches are going to be great for you too. All right, so let's go ahead and get started. So we'll do a couple of stretches standing, and then we'll transition our way onto the floor. So the first stretch is one I like to call a sort of a ballet dancer stretch. So you're going to shift weight into one foot, cross the other foot just gently behind, and you can see how my toes are just resting at the mat there. And you can start with the legs just in this position. Then you're gonna stretch the right arm all the way to the sky. So the same side as the leg that's crossed behind is gonna stretch up to the sky. Now you might start to feel just a general stretch all over the front side of that body. And the more you stretch and extend your spine and begin to arch your body up and back, the more stretch you're gonna feel throughout the whole front side of your body. So not just in the low abdomen, but up into the chest as well. So this is a delicious, delicious stretch. So of course, anytime you start doing a new stretch like this, you wanna be very gentle and listen to your body, making sure that you never feel pain in a stretch. So you should feel a nice gentle stretch, but never feeling pain. Let's take the other side. So cross the left foot gently behind and stretch the left arm up and back. So feel a gentle stretch through the left front side of your body. Good. So when I take stretches like this, usually I take at least 5 breaths in each stretch. You could go longer if it feels good to you. Good, and go ahead and release. The other thing that I forgot to mention at the beginning, of course, is if you've had a DIEP flap, you want to make sure that your incision is completely healed before you start doing these stretches, and you make sure that you've got permission from your plastic surgeon to go ahead and start doing these, just to make sure that the scar is stable and it's ready to start having some stretch into it. All right, so always ask your doctor, make sure it's okay before you start doing exercise. All right, now if you liked that sort of ballet stretch, but you want a little bit more, you can cross that foot over behind and just stretch it even further back behind, and then stretch that arm up to the sky. So you can see how extending that leg behind us is going to bring a little more stretch into the front side of that low abdomen and hip area. So again, 5 breaths here. Straightening that back leg will also stretch that area nicely. All right, good. Come back to the center. Let's take the other side. So cross the foot over, and you can stay here just gentle, but if you want more, stretch that foot further behind and stretch that left arm up and back. So really feel your left front side body stretching all the way from your shoulder down through your hip and into your thigh. As always, maintaining a nice calm breath. So if you're stretching so far, working so hard that your breath is getting away from you, you should back off a little bit. So we want to always have control of our breath and maintaining a nice, calm, even mind. All right, good. Come back to the center. All right, great. So if you have a cat and he's lying on your mat, you might need to move him. I'm always needing to move Vato. All right, buddy. Here we go. Lay at the back. All right. So if you've got a nice folded up towel or yoga blanket like we often use, you're going to go ahead and place that about in the middle of your mat. We're going to step back and put our knee onto there. If you like to use yoga blocks to get into things like a lunge or a low lunge, you go ahead and use those at the front of your mat. If you don't need them, then you don't have to use them. But I'll show it with the blocks because we're always using blocks to help keep our spine straight and keep us safe. So we're going to step back to a low lunge where our knee will land on the blanket. So let's inhale and stretch our arms up to the sky. Exhale, sitting our hips down, reaching for your blocks. And then you're going to step that left foot behind your blanket so that you can then reach the back knee down to your blanket. And then hands can come to your thigh. Now you can just feel a stretch here, and as you gently sink your hips forward, you'll feel a little stretch coming into those hip flexors. So the front side of your left thigh and into the low abdomen will start to feel a stretch. So being careful and being gentle and slow at first. You see how that stretch feels. You feel an extension of your spine. So feel your spine stretching up and out of your pelvis, and you might even feel a gentle back bend. And then see if you feel a little stretch move into your low abdomen there. Now, if that's fine and that's easy for you, then bring the arms up above the head and again stretch up and out of your hips as you gently bend backward. So you can see how that's going to be stretching the skin and the muscles on the front side of our body. Extend your spine, stretch up and back, and breathe. Good. Now, if that's too much stretch for you, you can keep your hips just above your knee. You don't have to sink all the way forward in the hips. Totally fine to do it right here as well. And just feel stretching up and back. And you're going to get a similar stretch. Not quite as deep as here, but if your hips aren't ready for that, stay right above the knee and stretch up and back. All right, let's bring our hands to our blocks and we'll make our way to the other side. So bring your right knee down to the blanket. Take the left foot forward. And let's take the other side. So again, hands come to your knee first. You see how it feels to stretch the hips forward. So sinking hips forward, you feel that right side hip flexors start to stretch. Feel your spine extend up and out. Imagine your spine's pulling up and out of your pelvis. Good, and if that's okay, stretch the arms up and bend gently back. So feel that front side of your body, especially the right side, stretching and getting loose. Again, never any pain in yoga, so only go as far as feels comfortable to you. You should feel a stretch, but never pain. Very nice. Now bring your hands to your blocks. Take those knees back to meet on your blanket and have a seat. Let's rest for just a moment. All right. So, as I mentioned at the beginning, often what we have is tightness on the front of our body and then weakness on the back side of our body. So some of the stretches we're doing are to extend and just stretch the front side of our body to open that area up a little bit. And then some of the stretches and exercises that we're going to do are to strengthen the low back a little bit. So this next one is a back bending posture called Camel that does a little bit of both of those. So again, you're going to want to have your knees on your blanket. So you bring the knees onto your blanket, you stand up on the knees, the feet are facing directly behind your knees. So you want to try not to let the feet come in and the knees splay out. You want to keep them parallel. So the lower legs are parallel to one another if possible. So the first step in Camel is to bring your hands onto your hips again. And I like to bring my thumbs really to that part on the back of your sacrum. And then feel your chest stretch up to the sky. So this is again that idea of extending the spine up and out. And then you're gently going to push your hips forward. Chest stretching up to the sky. So we're not dumping into our low back and trying to get into a back bend, right? We're extending up and out. I like to imagine I'm going to stretch up and over a limbo bar. So you're pushing your hips gently forward as your spine stretches up, chest to the sky. If it's okay, you can let your head hang back and really push those hips forward. So back bending postures can be really uncomfortable. It's super important to maintain your breath here. So don't hold your breath in a back bend. Feel your low back muscles contract to hold you there and feel the front side of your body open. Good. Inhale, come slowly up to the top and have a seat. Rest there for a moment. We'll take one more set and I'll show you how to get into it more deeply if that's comfortable to you. So if that first one is really easy to you and feels good and comfortable, we'll show you what to do for the next step. If, however, that felt like a really good stretch and you want to just stick with that, you can take a second set just like that. All right? All right, let's come back up for second set. So second set, knees about hips width distance apart, lower legs parallel to one another. Same thing, thumbs at your sacrum, stretch your spine up, push your hips gently forward, breathe deeply. If this feels okay, you let the head hang back. And if you want a deeper stretch, you can reach back and grab your heels. Now again, no need to reach back and grab the heels if you're getting plenty of stretch with your hands at your hips. It's perfect there. But if you want more, you can take it here. Once you get the heels, push the hips forward again. So you can see that front side of the body really opening up here. Again, breathing deeply, making sure not to hold your breath. Good, wherever you are, hands to your hips to slowly come up. And then sit your hips down and rest. All right. Awesome. So again, as I always say, remembering to take things slowly. As you first start doing these, if you've got a lot of tightness across your low abdomen, you might not be able to do all of these stretches in one sitting. So you might just do one or two of them, experiment and see what feels good with you. So after your regular yoga practice or after you've done some other kind of warm-up, you might just throw one or two of these on at the end. So don't feel like you have to do all of them right here at the beginning. All right, we're gonna make our way onto our belly for another low back strengthener and front body opener. So I'm gonna move my blocks and my blanket. I'm gonna move Vato a little bit again. Come on, buddy. Move to the side, okay? There we go. All right. Good, so you're gonna come to lie on your belly, and we're gonna do what I call Cobra rolls. So we're gonna roll our body up and down into Cobra, and we're gonna wanna use primarily the strength on the back side of our body. So the strength from our back muscles, not so much from our arms. So it's not really a push-up, it's a Cobra roll, all right? So you're gonna bring your hands out just slightly in front of your shoulders and to the outside of your mat. And you're gonna have your hands up on tented fingers. So we call these cupcake hands in yoga. So imagine there's a cupcake underneath your hand and you don't wanna smash it. So cupcake hands, zip your legs up, and then on an inhale, you're gonna contract your low back muscles and slowly peel your upper body up off the floor, and then exhale, roll it down again. We're gonna just do this 5 times. Inhale, peel yourself up, feel your low back contract. Exhale, slowly roll down. Inhale, contract your back muscles, pull yourself up. Exhale, slowly roll down. That's 3. Inhale, 4. And inhale, 5. Exhale, rest your body down onto the mat. You can turn your head to one direction or the other. So you can feel that this is stretching the front side of your body as you peel yourself up off the mat, you're stretching the front side of your body, and you're also strengthening those low back muscles that really need some attention. So this is so good for your back. It's gonna help keep you from getting into back pain issues and things like that. All right, let's take one more set of 5. As you start doing these, if they're easy for you, you can do more. So you can do 2 sets of 10 instead of 2 sets of 5 like we're doing today. Let's do 5 more. All right, belly down, hands into our cupcake hands. Zip up those legs, and on an inhale, contract your low back to peel yourself up off the floor. Exhale, roll it forward. Inhale up. Exhale, roll it down. 3. 4. And 5. Good, roll it down. Turn your head the other direction just to stretch your neck. All right, so you should be feeling a little warmed up. You might feel some blood flow going into those big muscles in your low back. That's excellent, gonna be so good for you. We've got just a few more stretches. So you're gonna roll over onto your back and bring the feet flat to the floor. So I'm going to show you that pelvic tilting motion here at the floor. So these are actually exercises that some people do to strengthen the muscles of the low abdomen, because when you tilt your pelvis forward, you're strengthening or engaging some of those deep muscles in the low abdomen. But then what I'm inviting you to do is then feel the anterior tilt as well, partly so that you get an idea and you start to notice the feeling of your pelvic tilt, so that you're aware of it when you're walking around during the day, and you can learn to start to correct that once you start to build the flexibility. So I'm gonna get my arms out of the way here. So when your feet are flat to the floor, sort of the natural curve of your back is such that you should be able to slide your hand underneath your low back. So your back shouldn't be totally flat on the floor in this position. But if you engage your low abdomen and push yourself into a pelvic tilt, you're gonna push that low back onto the floor. You can see you can't stick your hand under your low back anymore. When you do that, you feel the low abdomen engage. So the muscles of your low belly engage in a posterior pelvic tilt. And then you're going to release that and tilt your pelvis forward such that then you exaggerate that space underneath the low back again. Let's take just a few more of those. So push your low back into the floor, engage the low belly. And then release that and roll your pelvis forward, arching the low back slightly. 2 more times. Push the low back into the floor, engage the low belly. And then roll the pelvis forward, arching the low back gently. 1 more time. Roll the pelvis back, posterior pelvic tilt, engaged low belly. And then release it and roll the pelvis forward, engaging your low back a little bit. Good, and then release and come back to neutral. All right, so you can do as many of those as feel good to you also. All right, so let's reach for one of our yoga blocks. We're gonna take one of my favorite stretches here. So you're gonna grab your yoga block, and if you don't have a yoga block, then you could use a folded up towel, or a really firm pillow would do the same thing. We wanna just prop up our sacrum to get a little space underneath our pelvis. So you take the yoga block, you push your hips up into the air gently, and then you're gonna place the block just under your sacrum. So super important that you get it in the right spot. You want it under the big flat bone on the back of your pelvis. So not up here under your back so that your bum is hanging off, right? You want it under the sacrum, so it's supporting the whole weight of your pelvis on top of your block. So the first thing you might do is just rest here and see how this feels. This is getting a little bit of a stretch across the front of your abdomen. It's a very gentle bend, back bend of the low back. If that feels fine with you after a few breaths, you can see about extending one leg and sort of resting the weight there. You can see how when that leg extends, you're stretching gently the front side of your belly here. So see how that feels. Let that side stretch gently. Good, and then return that foot and stretch the other side. So left leg extends. Feel the left side of your belly stretching nice and open. Relaxing the rest of your body. You're just kind of melting on top of your block, letting the block support your pelvis to get you into this shape. Now, if all that's okay, then you can extend both legs long and see how that feels. So you can see how you're getting a little stretch across the front of the abdomen, but you're not having to do any effort. So you're just resting completely easy here on top of your block. So if this feels really good to you, you can just do this every morning. Get down on your floor beside the bed and gently stretch that abdomen nice and open. But again, if it feels painful, you need to back off. So you might need both knees up a little bit at first until you start to get the stretch. So you just measure it and you see how it feels to you. If it feels good to be all the way down, then you stretch all the way down. Very good. All right, bring both feet back to place. Lift your hips up and remove that block. We're going to have one final stretch, and then we'll be done with stretching your low abdomen and strengthening your low back. So for this one, I like to bring my arms out to the sides, and then you're going to have feet flat to the floor, but separate your feet to the wide edges of your mat. And then you're going to let your knees fall over to the left and turn your gaze to the right. So this is a gentle spinal twist, but when you get into it, you'll see that you feel a stretching of the low abdomen. It's sort of a twisting stretch that's going to get a little different movement in through that scar and that tightness in your low belly. If this feels totally fine to you and you've got no pain and you want a deeper stretch, you pick up the left ankle and set it on top of your right knee. It gives some leverage to that internal rotation of the right thigh, which stretches the hip a little bit more. As you know, if you've done some of our yoga practices, I often use this stretch at the end of practice. It feels so good to wring out the body, stretch that low
low abdomen, hip, and low back all in one. So resting completely with your chest, allowing yourself to melt into your mat, letting gravity stretch you. All right, good. Release that side and we'll take the other side. So again, feet at the wide edges of your mat. Let your knees fall to the right and your gaze turns to the left. So feel that low belly and hips stretch and open. And if that feels fine or you want a little more stretch, you pick up the right ankle, put it on top of the left knee, and feel that leverage twist you just a little bit more. Breathing deeply through all of these exercises. Relaxing your body, relaxing your mind. Always being patient with yourself. So not getting in too much of a hurry to stretch things too quickly. Always take it easy and slow. Super patient with your recovery. All right, good. Go ahead and release that side. If you feel like you've had a delicious stretch and you want to stay here for a few minutes of rest in Savasana, go ahead and do that. You can rest your arms down at your sides and just let all of those stretches soak in. I'm going to go ahead and come up to a seat. So again, this has been a video to help stretch the low abdomen, especially for my girls who've had a deep flap and have a lot of tightness in that low abdominal scar, but also for anybody who sits in a chair a lot at work and you end up with some weak low back muscles and contraction on the front side of your body. So all of these stretches are great. Again, take your time, be very patient, be gentle with yourself, and slowly your body will get more flexible and you'll build strength in the places that you need it, such that you'll feel better just walking around every day in your life. So as we say, you know, yoga is not about what sort of contorted positions we can put our body into. Yoga is about making us feel better and be better in the rest of our life off the mat as well. So hopefully these will make you feel better as you go out into your day today. All right, guys, so thank you so much for being with us. Thank you for giving yourself this beautiful gift of yoga. Namaste.